Hey there! Once your baby is born and the cord has been cut off, you need to watch out for it carefully to make sure that it heals properly. Has your baby's umbilical cord dried up and has fallen off? And do you notice a red lump of tissue on your baby's belly button? Well, it might be an umbilical granuloma. It looks scary, but it is just a minor problem, and it does not cause pain on your baby. In this video, we will talk about what is umbilical granuloma. We'll also talk about stump bleeding. And in this video, we will talk about how is umbilical granuloma treated and how to take care of it at home. Hi, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems in order to raise happy and healthy kids. Umbilical granuloma. We will talk about a common umbilical cord problem, which is the umbilical granuloma. Sometimes, instead of your baby's umbilical cord completely drying off and falling off, a small red lump of scar tissue is found in your baby's belly button. This is known as the umbilical granuloma. Sometimes it might drain a light yellow fluid. It usually goes away in about a week, but if not, your pediatrician may need to burn it off or cauterize it. Then, another umbilical cord problem is the stump bleeding. As you care for your baby's umbilical cord, you might notice a few drops of blood in the umbilical area or in your baby's diaper around the same time the cord has fallen off. Well, this is normal. But if it is actively bleeding, you should let your doctor know immediately. The cord can become infected as well, and this would require treatment. Although cord infections are not that common, you should worry and let your doctor know if you notice a foul-smelling yellowish discharge from the umbilical area, if the skin around the base of the cord looks red, and if your baby is crying when you touch the cord or the skin around the cord. The umbilical granuloma should be treated, otherwise it can get infected. The most common form of treatment is that doctors would use silver nitrate around the granulomatous tissue, which burns it off. There are no nerves in the area, so it does not cause pain on your baby. If this procedure does not work, or if another option is desired, talk to your doctor about it. Another option is liquid nitrogen, which is poured on the granulomatous tissue that freezes it, and then the tissue would dissolve. Another option is that a little salt is placed on the granuloma, and this is covered with a gauze and left for 10 to 30 minutes. After that, the area is cleaned and wiped off with the gauze with warm water. And then this procedure is repeated twice a day for about 2 to 3 days. If this still doesn't work, bring your baby to your pediatrician. And in rare cases, surgery is performed. Now, how to go about follow-up and how to take care of your baby's umbilical cord at home. Well, before we go to that, are you expecting a baby? Or you already have a newborn? Well, congrats, mom and dad. How much better life can be when things are under your control upon baby's arrival, where you feel confident about breastfeeding your baby, when you know how to soothe a crying, fuzzy baby, when you know when to worry and call the doctor, when you can understand your baby's sleep schedule and better take care of baby and take care of yourself as well. I have developed an online training video series known as the 5 Newborn Care Strategies. Do check that out in the description section. It is online, so you can have access to it anytime, anywhere, any day that you might need to. Well, follow-up is important in your baby's treatment and of course for your baby's safety. So it is important to go to all your doctor's appointments and Let your doctor know if you note any signs of infection around your baby's cord. How to take care of your baby's belly button at home? Well, the best care for your baby's belly button is to keep it clean and dry. Gently clean the area with warm water and soap. And follow your pediatrician's instructions. It is also helpful if you expose your baby's belly button to air. You can do this by folding the front of the diaper area and so that the belly button is not covered. And avoid placing your baby in a bathtub until the cord has completely dried and healed. Are you still worried about your baby's umbilical granuloma? Well, an umbilical granuloma that is treated effectively does not result in any complications. So, if you notice an umbilical granuloma forming when you note a small red lump in your baby's belly button that might be draining a small light yellow fluid, well, tell your pediatrician about it immediately. Let your doctor know if your baby's umbilical granuloma is accompanied by fever of 38 degrees Celsius or 100.4 degrees Fahrenheit. If you notice active bleeding around the umbilical area, if this is accompanied by swelling or redness, or if your baby feels pain or is crying when the area is touched, and if you notice a foul-smelling yellowish discharge, or if there is a rash around the umbilical area. Did you find this video helpful? How about you share it to 3 of your friends who might need it as well? And watch my next video where I teach you about other child health problems.